Hi and good morning. I'm Meagan Luevano. I'm the Public Information Officer at the Placer Mosquito and Vector Control District.
And I'm Joel Buettner. I'm the General Manager at the Placer Mosquito and Vector Control District.
Thanks for having us today. We're going to get started and go over our annual update.
To introduce who we are an independent, non-enterprise special district in Northern California that's governed by California Mosquito and Vector Control Law and a 7-member Board of Trustees. We have 22 full-time staff members and we hire annual employees for seasonal work. Our district mission is to effectively and efficiently manage the risks from vectors and vector-borne disease in order to protect public health and quality of life in Placer County. And our district vision, not too far off from that, is to provide the best public health protection from vector-borne disease through innovation, collaboration, and science-based integrated vector management to make Placer County a safe place to live, work, and play. So this is a map of our service area that shows the different parts of Placer County from West Placer to Mid to East Placer. And it shows the different types of vectors in each area that are most common. So in West Placer, you see that mosquitoes and West Nile virus are the most prevalent. In Mid Placer, that's where we see mosquitoes and ticks that can spread Lyme disease. And in East Placer, you see yellow jackets and also rodents. So what we do, the district uses an integrated vector management approach to manage vector populations and the risk of vector-borne disease transmission. Integrated vector management is a decision support system for selection and use of vector management strategies separately or in combination for an overall management approach. We have many different programs that help us manage vectors and vector-borne disease risk in the county. We use vector and disease surveillance, chemical control, biological and physical control, community outreach, technology and innovation, as well as applied research. We were extremely busy in 2020 despite minor modifications to our services due to the COVID-19 pandemic. So this is just a quick overview by the numbers of some of the activities we did. We had 13 drone applications to treat larval mosquitoes. We had 58 positive West Nile virus mosquito samples. We did 92 Good Neighbor Project service requests to look for invasive Aedes aegypti that we did not find in 2020. We hired 4 seasonal staff members and we conducted 57 aerial and ground-based larvicide and adulticide treatments. In 2020, we also refreshed our placermosquito.org website to better serve Placer County and continue to protect public health. The new site features a user-friendly navigation and detailed information on how you can protect yourself from mosquitoes. We make it easy for the public to submit problem reports with 2 ways to access the service request form from the homepage. The public can submit reports for mosquitoes, yellow jackets, ticks, and standing water, to name a few. Our technicians review the requests and decide the appropriate response necessary. In 2020, we had to adjust our in-person outreach and events to virtual experiences. You're looking at our school outreach program that was assembly-based, but is now available on YouTube. We also created whiteboard videos to explain more complicated topics like specific mosquito species and their behavior. We plan to continue developing digital content to reach the county effectively about different topics that affect them. Joel's going to talk to you a little bit more about the different vectors and vector-borne diseases that we find in the county.
In Placer County, we focus on 3 main types of vectors: mosquitoes, ticks, and yellow jackets. Mosquitoes and yellow jackets are our main concern during the summer months, and ticks during the cooler and wetter parts of the year. Vector-borne diseases that are transmitted by mosquitoes and ticks are the primary risk to public health. West Nile virus, St. Louis encephalitis, and Lyme disease are the most commonly detected in vector populations, with a small number of rodent and flea-borne diseases like hantavirus and plague detections from time to time. Historically, malaria was very common but has not been detected in Placer County in many decades. Invasive mosquitoes that are able to carry other serious diseases like Zika, dengue, chikungunya, and yellow fever are very serious. And that's why we're very motivated to early detection and eradication of invasive mosquitoes if we find them. Protecting our communities from vectors is possible only through a partnership between the district and the public. District responsibilities are to monitor vectors and diseases in the environment and communicate those risks to the public. Manage mosquito populations using integrated vector management tools like adult mosquito control, larval mosquito control, biological control, and physical control. We also make these decisions based on sound scientific practices, data, and procedures. The public responsibilities are to defend yourself from mosquito bites by wearing repellent and using protective clothing, drain standing water, and maintain your properties to minimize that standing water in containers that can hold water. And then contact the district to report any mosquito problems that you might be experiencing. The mosquito outlook for 2021 is difficult to predict specifically, but based on likely drought conditions this summer, we know that we tend to see increased West Nile virus incidence in the mosquito populations during droughts. This is because the birds that carry West Nile virus, the mosquitoes, and even people tend to congregate around fewer water sources, which increases the risk of transmission. Invasive mosquitoes were detected in 2019, but not in 2020. So we will continue to look for new detections of invasive mosquitoes and conduct eradication efforts again if needed. The upper graph shows the past 3 years of the 3 most abundant mosquito species by week. The red and purple lines are the West Nile vector species, Culex tarsalis and Culex pipiens, and the brown line is the Anopheles freeborni mosquito that tends to cause a lot of nuisance biting, but does not carry diseases currently. The lower graph shows the number of West Nile positive mosquitoes and dead birds detected by week. You can see that in 2018, we had very high mosquito abundance around July and August, and a corresponding spike in West Nile virus incidence. In 2019 and 2020, however, the West Nile virus incidence was much lower, although the mosquito abundance has stayed fairly stable. For 2021, we can expect to see increasing mosquito activity in all parts of the county as temperatures begin to warm, and our first West Nile virus detections in mosquitoes around the latter part of June or early July. That's when you can expect to see information from the district about adult mosquito control operations and reminders to wear repellent in high-risk areas. Starting now, district staff are working hard to do mosquito control for mosquito larvae, which will prevent those summertime adult mosquitoes, and implement biological control and physical control where appropriate.
We thank you for joining us today for our annual update. We could be reached at placermosquito.org. We can be found on social media at the handle @placermosquito, and then you can also give us a call or shoot us an email. Thank you so much.